I've always seen NMC as being small enough so that we know one another, but big enough that we can do interesting things.
Navigating healthcare, whether it's emergent or elective reason, is complex, and we strive to make that complexity easier. And so we would hope that when people leave, they're focused on that they got the care that they needed, they felt heard, and that we cared about them.
I'm Jonathan Billings. I'm the Interim Chief Executive Officer at Northwestern Medical Center in St. Albans.
My name is John Minadeo. I'm the Chief Medical and Chief Quality Officer at Northwestern Medical Center.
Northwestern's history dates back to 1883, and we have served the community since then. And it's exciting now for us to be not only focused on our community's current needs, but also what does it need in the future.
Yeah, I think most people, when they think of a community hospital, will expect you to have high-quality emergency department, inpatient care, surgery, and obstetrics, which we do have. But people might also be surprised we have an ear, nose, and throat specialist, an ophthalmologist. We have inpatient pediatric specialist, as well as an outpatient pediatric developmental clinic.
Learning that Northwestern ranks as one of, if not the lowest cost hospitals in the state of Vermont catches people's eye, particularly folks with high deductible plans as they become more cognizant of the costs of healthcare. That's a pleasant surprise for our community and beyond. And similarly, NMC currently ranks as the highest rated quality hospital in the state of Vermont within the Leapfrog national rating system.
It's vital that we work as a system and we work across departments, and we really focus a lot on teamwork.
We have the ability to bring everyone together on a particular issue, look at the data together, explore the best practices together, and then chart our course forward. And that collaboration and collegiality is really a special hallmark of a small hospital. I think NMC being involved in community events and our community being involved in NMC's events like the Run for Jim or the Cardiac Champ Challenge allows for connection, and it brings understanding and relationships that when someone has a medical need, there's familiarity there, and that becomes the basis for trust. Hopefully when our community sees us on Vermont Public, they understand that we are working to get our message out around access to healthcare and affordability of healthcare, and that it is credible and reliable, and that they understand from one partner that they trust, that they have another partner that they can trust. I think one of the interesting connections between Vermont Public and Northwestern Medical Center is fundamentally we are about access to important things, whether that is important information and programming or that's important care in someone's life. We want to make sure that what they're accessing is high quality and worth their time and beneficial to them, but at the same time is delivered at a cost point that is workable for them. And Vermont Public stands out in that, and NMC strives for that. And we appreciate the parallels between the two. It feels like we do different things, but we do them the same way.
We lived through it. Hey, nice work.
Right there.